Good evening, everyone. Yes, the 17th, Senator Parker, we have a town hall meeting at the State Building in Wilmington. That's the federal, what is it called? Carvel Building. Thank you. It's from 2 to 4, and it's going to be upstairs in the auditorium.
Which floor?
Second floor. Second. Yes. And the cards.
And cards. Will the government use its strength to negotiate lower prices with big pharma?
Let me give you some perspectives on that. First of all, I'm sorry, let me repeat the question. The question is about price negotiation, drug price negotiation. And I think there's, will the government leverage its bargaining power to negotiate prescription drugs? There's a couple places where that issue comes up. One is in the context of the Medicare program, where when we passed the Part D prescription drug benefit in the Medicare program, under a different Congress and president, we were not able to secure negotiation of drug prices. The other context in which it comes up is the public plan option in the exchange. So this new marketplace for health insurance, which will be very well regulated, will have private insurers and a public plan option. At least that's our hope. And one question is, will the public plan be able to negotiate? How will the public plan proceed to purchase healthcare services, one of those being prescription drugs? And will they be able to negotiate prices for prescription drugs? The answer is twofold, therefore. I think that we will probably not see prescription drug pricing in the Medicare program right now in this healthcare reform package. And one reason is it actually, there are no good reasons, but the Congressional Budget Office doesn't score it as saving any money. And so it's a very difficult political lift because of the power of the pharmaceutical industry. And since it doesn't score official savings, there's a reluctance to take it on. I think that if we preserve a public plan option in the exchange, we will see the Secretary being given the authority to negotiate all healthcare service prices, including prescription drug prices. And that's actually even in the compromise so-called Blue Dog bill, there is price negotiation by the Secretary. Rates are not tied to the Medicare program, which is another approach. I'll give you an opinion now about this. Right now, the pharmaceutical industry is actually supporting healthcare reform. And obviously, it's in their interest to expand their consumer base. And they are running ads across the country to the tune of about $25 million of paid media ads in support of healthcare reform. And my organization has partnered with them on some of those ads. If we go after price negotiation right now, that will all come to an immediate standstill. And they will take $125 million and do paid advertising in opposition to healthcare reform. So one concern is, will we really have their deep pocket come after us? So we're trying to decide how far we can go on this issue. And it's a tough call because, frankly, they have the dollars and the power to purchase the advertising that could stop this dead in its tracks. I do think we can get Medicare price negotiation possibly in 2010 or 2011, but I think it could be a death knell for healthcare reform. So that's not always the answer everyone wants to hear, but that I think is my best sort of analysis of the situation.
Okay, I understand that maybe 4 more years before a public plan goes into effect, even if we get one. What is going to keep insurance companies from huge rate hikes during this time, since they will be anticipating future limits on their profits?
I alluded a little bit to this. It is correct that the exchange, or gateway, this new marketplace of regulated private insurance in which the public plan will be one choice among many for healthcare purchasing, won't be in place until 2013. And it may be state exchanges, it may be national exchanges, and so your public plan option doesn't come into play until you create this new marketplace. That's 2013. But the medical loss ratio issue, this regulation that says you have to spend the premiums that come in, you have to spend most of them, and it could end up higher than 85%, but you have to spend them on actual healthcare services, kicks in at the end of 2010. Rate review kicks in sooner. Revocation issues that I talked about kick in 2010 immediately. There is a phase-in the House bill of the pre-existing condition rules, so it doesn't overnight say we can no longer charge you more or deny you coverage because of a pre-existing health condition to insurers, but it starts to phase that in so that at 2013 you achieve that full regulation will be in place and there'll be no more discrimination against people with pre-existing conditions. So a lot of things happen right away, but some things won't be in place until 2013. The Medicaid expansion, and this is the one that's, I guess, nearest and dearest to my heart, which will really help a lot of low-income people, will start in 2013. And I wish I could say we had a chance of getting that started sooner, but we don't. The cliff at which point states have to start paying for that is 2015. So that's a concern. So different timelines for different pieces of the bill, but the exchange itself and the public plan option is 2013.
Should one of our main demands be for Representative Kucinich's proposal to allow states the freedom to choose a single payer system?
There's been proposals on the table over the last 5 to 10 years, and in fact, the Heritage Foundation, which is a right-wing conservative think tank, has proposed that states each be allowed to create their own system to arrive at universal coverage or something close to coverage. And they like the proposal where states each are given the ability to choose their own path. And I frankly would be very nervous in many, many states across the country about losing it at the state level and trying to fight that out in 50 states at the same time. So my answer is I don't think it has political legs doing state demos, and I would be worried about losing more states than I win if we gave them the flexibility to go to something that would look like a single payer system at the state level. We often get a question about whether a single-payer national system is feasible, and my best judgment is that it is not feasible in this country at this time. But I think many people view the public plan option in the exchange as an important element of the hybrid that we are now moving forward in Congress that will satisfy the need for many folks to see a public plan option be part of what we're trying out in a new world of regulated insurance. So I'll leave it at that.
I work in healthcare. I'm a nurse. How do I speak to doctors to support healthcare reform? They're afraid Medicare will cap what they make. It has already been cut. Doctors need to be paid as well.
It's a real issue that many Medicare providers are underpaid. It's also a real issue that many, in my opinion, Medicare...
Excuse me, Kathleen, I'm sorry, there's an issue in that folks can't hear the original question.
Oh, I'm sorry. Why don't you step up? Have some fun at the mic, too.